Hey everyone, ready for another deep dive? We're tackling AI in healthcare today, specifically all the buzz around LLMs.
Large language models.
Right. LLMs, large language
That's what
models.
LLM stands for.
Exactly. But it can feel like every other day there's a new article about how AI is going to revolutionize healthcare.
It's definitely a hot topic.
And I think a lot of people are like, okay, is this all hype or is this the real deal? So you sent us this super interesting research article, and it actually digs into how we can figure out if we can actually trust LLMs in healthcare.
Yeah, this one is really interesting. It goes beyond the hype.
Right. And it's not just like, AI is going to solve all our problems, end of story. It actually looks at how we evaluate these LLMs, and it emphasizes human judgment, which I thought was really fascinating.
Yeah, because it's not enough to just look at the numbers, like how accurate an LLM is.
Right. Like, just because an AI can spit out a diagnosis doesn't mean it understands the nuances of a patient's situation.
Right. Exactly. Like, think about bedside manner. A doctor could be brilliant, but if they can't communicate effectively with their patients...
Yeah, they have zero empathy.
Right. Then the patient might not trust them, or they might not follow the treatment plan.
So having that human touch, even in evaluating AI, is super important.
Totally. And that's where this research comes in. This study is called A Framework for Human Evaluation of Large Language Models in Healthcare, derived from literature review.
A bit of a mouthful.
Yeah, but it was published in partnership with Seoul National University Bundang Hospital, which is a pretty big deal.
Yeah, definitely adds some weight to it. And for anyone who wants to follow along, the DOI link is in the show notes. https://doi.org 10.103884174602012587.
So one of the things that really struck me about this article was this idea that we need to go beyond just looking at traditional metrics like accuracy.
It's like you said before, there's more to healthcare than just getting the right answer.
Exactly. It's about the whole picture, the patient's experience, the ethical considerations, the potential for harm, and all of that requires human judgment.
It's like, an LLM could give a technically correct diagnosis, but completely miss the emotional needs of the patient.
Exactly. And that's where things can go wrong.
It's like having a robot doctor. No thanks.
Haha, yeah. So the researchers in this article, they actually developed this framework called QUEST.
Quest, like a quest in a video game.
Kind of. But this QUEST is all about guiding the evaluation of LLMs, and it's based on 5 key principles.
Okay, I'm intrigued. Lay it on me. What are these 5 principles?
Okay, so we have quality, understanding, expression, safety, and trust. And each of these principles is super important when we're thinking about whether or not an LLM can be trusted in healthcare.
Okay, so quality, understanding, expression, safety, and trust.
You got it.
So let's start with quality. What does that actually mean in the context of LLMs?
So quality is all about making sure the information that the LLM is using is accurate and up to date. Because if an LLM is giving doctors outdated treatment information, that could have some pretty serious consequences.
Like, imagine an LLM recommending a cancer treatment that's been proven ineffective.
Exactly. That's why quality is so important.
Makes total sense. So what about understanding? What does that entail?
Understanding is about, can the LLM actually understand the context of a medical situation? Can it take in patient data, connect the dots, and draw logical conclusions?
So it's not just about parroting back information. It's about actual comprehension.
Right. It's like if you tell an LLM about your symptoms, can it actually figure out what might be wrong with you, or is it just going to give you a generic response?
Yeah, like, take 2 aspirin and call me in the morning.
Exactly. Especially when you think about something like mental health support, where it's all about nuance and individual needs.
An LLM that just gives generic advice wouldn't be very helpful at all.
So yeah, understanding is crucial.
Okay, I'm starting to see how this all fits together. So we've got quality, understanding. What's next?
Expression. And this might seem a little surprising at first, but how an LLM communicates is really important.
Because if it's just giving robotic, emotionless responses,
it's not going to build trust with patients.
Yeah, no one wants to hear you have a 98.7% chance of experiencing a negative outcome.
Exactly. It needs to be able to communicate clearly, empathetically, and in a way that patients can actually understand and act upon.
So it's not just about what the LLM says, it's how it says it.
Exactly. It's about that human touch, even in an AI.
Okay, I'm liking this QUEST framework more and more. What's the next principle?
Safety. And this one is, I'd say, maybe the most important principle in any healthcare application. It's all about making sure the LLM won't put a patient at risk.
So could its actions, or even its inaction, potentially harm someone?
Right. Imagine an LLM chatbot that tells someone not to go to the emergency room when they really should. Yeah, the stakes are really high, so we need to be absolutely sure that these LLMs are safe to use.
I'm seeing a theme here, a lot of responsibility.
And lastly, we have trust.
Okay, trust. I feel like that's kind of a big one.
It is. Because at the end of the day, if patients and doctors don't trust the LLM, they're not going to use it.
It makes sense.
Right. So the LLM needs to be reliable, unbiased, and truly working in the best interests of the patient.
So it's about building confidence in the technology.
Exactly.
Okay, so we've got these 5 principles: quality, understanding, expression, safety, and trust. It's like a scorecard for evaluating how well an LLM can handle the complexity of healthcare.
You got it. And it's really interesting to see how these principles play out in the real world. The research actually highlights a bunch of different applications of LLMs in healthcare.
Yeah, I was reading about that. It's not just about diagnosing diseases. There's a lot more to it.
Right, like clinical decision support is a big one.
So helping doctors make diagnoses and treatment plans.
Exactly. But we're also seeing LLMs being used in medical education.
So helping future doctors learn.
Yeah, and even some more unexpected applications like mental health support and helping doctors write better patient notes.
Oh, that's interesting. Because clear communication is so important in healthcare.
Totally. Even something as simple as making sure patient notes are easy to understand can make a big difference.
And I'm sure a lot of patients would appreciate not having to decipher their doctor's handwriting.
Yeah.
But, okay, so we've got all these different applications, but how do we know if an LLM is actually good at these tasks?
Well, the article talks about some really interesting real-world examples of LLM evaluation.
Give me an example.
Okay, so one example is using LLMs for real-time patient monitoring. Like, can an LLM accurately detect early signs of patient deterioration?
Oh, wow, that's high stakes.
Yeah. So researchers are using these LLMs to analyze things like vital signs, lab results, and even patient notes.
And then they compare the LLM's assessments to those of human experts.
Right. And that's how they're starting to figure out how well these LLMs can perform in real-world settings.
And it's not just doctors who are doing the evaluating, right? The research also talks about the importance of getting input from non-experts.
You're exactly right. Because whether you're a patient, a doctor, or just someone who's interested in AI, you have a stake in how these LLMs are being developed and used.
Because ultimately, these technologies are going to impact all of us.
And the article makes a really good point that non-expert evaluation can sometimes bring a fresh perspective.
Like they might notice things that experts might miss.
Exactly. So it's all about getting a well-rounded view of how these LLMs are performing.
And how they might impact our lives.
Right. And speaking of impact, one thing that the research really highlights is the potential for bias in LLMs.
Yeah, that's something I've been thinking about a lot, especially when we're talking about healthcare, where bias can have really serious consequences.
Exactly. Like imagine an LLM that's more likely to recommend certain treatments to certain groups of people.
Or misdiagnose certain conditions based on someone's race or gender.
That's why it's so important to address bias head-on.
So how does this Quest framework actually address the issue of bias?
Well, it encourages us to look beyond just fairness.
So not just whether the LLM is treating everyone equally.
Right. We also need to consider the potential for harm, misinformation, and even something called hallucinations.
Hallucinations? Like the LLM is seeing things.
Kind of. It's where the LLM might generate completely made-up facts.
Wow, that's a little unnerving.
Yeah. So we need to be very careful about making sure these LLMs are grounded in reality.
Because the last thing we want is an LLM that's making things up when it comes to our health.
Exactly. And that's one of the challenges with LLMs right now. They're still kind of black boxes in a lot of ways.
So we don't fully understand how they're arriving at their conclusions.
Right. And that can be a bit unsettling.
It's like we're trusting these LLMs with important decisions, but we don't fully know how they're making those decisions.
It's a bit of a paradox, and that's why this research is so important. It's pushing us to make these LLMs more transparent and accountable.
Because we can't just blindly trust AI.
Exactly. We need to be critical thinkers and demand evidence.
And that's what this deep dive is all about, helping you understand how to navigate this complex world of AI in healthcare.
We're in this together.
So it really feels like we need a healthy dose of both optimism and caution when it comes to AI in healthcare.
Oh, definitely. Like, we don't want to just jump on the bandwagon because something is new and shiny, but we also don't want to dismiss the potential benefits.
We need to be informed and critical and make sure that these LLMs are truly serving the needs of patients and healthcare providers.
Absolutely. And I think this research really lays the groundwork for that kind of responsible development.
So it's not just about the tech itself. It's about understanding how to evaluate it and make sure it's being used ethically.
Exactly. And honestly, I think understanding how to evaluate these LLMs might be even more important than the technology itself.
More important.
Yeah, because without proper evaluation, we could end up deploying LLMs that do more harm than good.
I see what you mean.
Especially in healthcare. You know, the stakes are just so high.
Yeah, and it's crazy to think about all the ways these LLMs are already being used.
I know it's moving so fast.
From helping with diagnoses to even providing mental health support.
And those are just the applications we're seeing now. Like, who knows what the future holds?
Kind of mind-blowing to think about.
I know, right? Like, imagine personalized treatment plans generated by AI or virtual assistants that can answer your medical questions any time of day or night.
Or even robotic surgeons guided by LLMs.
It's pretty wild to think about.
It really does feel like we're on the cusp of a whole new era of healthcare.
It's definitely exciting.
But it also makes it even more crucial to have those frameworks in place, for evaluating these technologies.
Absolutely. And I think Quest is a really great starting point. It gives us this concrete set of principles to consider.
It's like a checklist for responsible AI development.
Exactly. And I think the biggest takeaway here is that we can't just blindly accept the promises of AI. We have to demand evidence that these LLMs are safe, effective, and trustworthy.
We need to be informed consumers even when it comes to healthcare technology.
Exactly. We all have a role to play in shaping the future of AI in healthcare.
I love that.
It's not just up to the experts, it's up to all of us.
So what would you say is the single most important thing to consider when evaluating an LLM for healthcare?
Ooh, that's a tough one.
If you had to pick just one?
I think I'd have to go with potential for harm.
Harm.
Yeah, like above all else, we need to be absolutely certain that any LLM used in a healthcare setting won't put patients at risk.
That should be the top priority.
Because even if an LLM is incredibly accurate and efficient, if there's even a small chance that it could harm a patient, then it's not worth the risk.
I think that's a really important point.
And that means looking beyond just the technical aspects of the LLM, we need to consider the ethical implications.
The potential for unintended consequences.
Right, and the impact on the doctor-patient relationship.
So it's about taking a holistic view, really considering both the science and the human element.
Exactly. It's about recognizing that LLMs are tools, and like any tool, they can be used for good or for ill.
It's up to us to make sure they're used ethically and responsibly.
With patient well-being at the forefront.
Well said. I think that's a really important message to emphasize.
It really is.
We've covered a lot of ground in this deep dive so far, from the basics of LLMs to this Quest framework and the importance of human judgment.
It's been quite a journey.
But I think it's so crucial to have these conversations, to really dig into the complexities of AI in healthcare.
I agree, and I hope our listeners are feeling more informed and empowered to engage in these conversations.
Because ultimately, the future of AI in healthcare is something we're all going to be shaping together. It's exciting and a little bit scary all at the same time, right?
Yeah, it really is. Like, we're at this point where we have this incredible technology with so much potential, but we also have to be really thoughtful about how we use it.
Because the choices we make now are going to have a huge impact down the road.
Exactly. And, one thing that the researchers emphasized in this article was that LLMs are still in their early stages of development.
So we're still learning about what they can do and what their limitations are.
Right. And that means that we need to be extra cautious, not just rushing ahead without thinking about the consequences.
It's like we're exploring this uncharted territory.
Yeah. And we need to make sure we're doing it responsibly, with a focus on the human impact as well as the scientific advancements.
So it's not just about building the most powerful AI. It's about building AI that actually benefits humanity.
Exactly. It all comes back to that idea of human-centered design.
Making sure the technology serves our needs, not the other way around.
And that's where human judgment is so important. We need to be the ones guiding the development of these LLMs, making sure they're being used in a way that's beneficial for both patients and healthcare providers.
So before we wrap up this deep dive, I want to leave our listeners with a question to ponder, something to really spark their own thinking about this.
Oh, I love a good thought-provoking question.
So imagine you're tasked with designing a human evaluation for an LLM. Let's say one that's going to be used to help diagnose patients.
Okay, I'm imagining.
What would be your top priority? What's the one thing you absolutely need to be certain of before you'd feel comfortable with that LLM being used in a real-world medical setting?
That's a really great question, and it's one that I think everyone listening should be asking themselves.
Because like we've been talking about, the future of AI in healthcare isn't something that's going to be decided by, a small group of experts.
Right. Something that's going to impact all of us.
So we all need to be part of the conversation.
Exactly. So think about it. What matters most to you when it comes to using AI in healthcare?
What are your non-negotiables?
What would make you feel comfortable and confident in trusting an AI with your health or the health of your loved ones?
Those are really important questions to consider.
Yes.
Well, we've covered a lot of ground today, from those, the basics of LLMs and the Quest framework to the importance of human judgment and the need for a cautious but optimistic approach to AI in healthcare.
It's been a really fascinating discussion.
And I hope our listeners are walking away feeling, more informed, empowered, and maybe even a bit inspired to engage in this conversation about the future of AI.
Because it's a conversation that we all need to be having.
Absolutely. And on that note, we'll wrap up this episode of The Deep Dive.
Thanks for listening, everyone.
Until next time, stay curious, keep learning, and don't be afraid to ask those tough questions.